My name is Dr. Rachit Gulati. I am the head of the Department Physical Medicine and Rehabilitation at ISIC Multispeciality Hospital, New Delhi. The goal of Physical Medicine and Rehabilitation Department is simple: to restore dignity, function and independence for every patient who walks through our doors. Rehabilitation is not just about exercises. It's about making the patient return to the life fully. We work with patients who are recovering from pain, injury, illness, surgery, or various disabilities and create personalized, customized, goal-oriented rehab plans that focuses on real-world outcomes. At ISIC, we provide chronic pain rehabilitation, musculoskeletal rehabilitation, neuro rehabilitation for cases like stroke, spinal cord injury, traumatic brain injuries, pediatric rehabilitation for cases like cerebral palsy, autism, ADHD, amputee rehabilitation, psychological rehabilitation, ergonomics and workplace-related rehabilitation, pulmonary and cardiac rehabilitation, gynecological rehabilitation, and many more. Through ISIC, we deliver outpatient, inpatient, and home-based rehabilitation depending on the patient needs. We provide care for patients with stroke and paralysis, chronic back or neck pain, joint pain or arthritis, spinal cord injury, cancer-related weakness or fatigue, frailty, risk of falls or weakness in the adults, developmental disorders in children, Parkinsonism and other movement disorders, gynecological issues, and many more. Basically, if you are suffering from any sort of pain, stiffness, or difficulty in daily activities or weakness, you belong here in Physical Medicine and Rehabilitation Department. Apart from the regular care, what truly sets us apart is our state-of-the-art advanced rehabilitation therapies. First one is aquatic therapy or hydrotherapy. ISIC Multispeciality Hospital boasts of a temperature-controlled swimming pool that allows therapy inside the water that creates less stress on the joints. It is especially useful for patients with chronic pain, post-surgery, stroke, or other movement-related issues. Virtual reality. Virtual reality allows the rehabilitation to be enjoyable and interactive, allowing movement, balance, and even cognitive tasks performed very simply through task-specific training. Next is functional electrical stimulation. Gentle impulses are carefully passed to the weak and paralyzed muscles, allowing walking, hand function, and preventing muscle wasting. Next is orthosis and prosthesis workshop. At ISIC Multispeciality Hospital, we assess, customize, and train patients with specialized braces, walking aids, mobility aids, and even prosthetic devices that helps them to return to the function much more quickly. Next is gait and balance analyzers and trainers. We assess the walking patterns and the posture of the patients very scientifically and train them specifically so that they are able to improve their posture, reduce their ergonomic related injuries, and are able to function better. The most important aspect of rehabilitation department at ISIC Multispeciality Hospital is that the entire rehabilitation journey of the patient is led by a physiatrist who is an MD grade doctor who coordinates the team of physiotherapists, occupational therapists, speech therapists, orthotists, psychologists, nutritionists, and social workers. This ensures accurate diagnosis, medically driven rehabilitation care to the patients, coordinating the whole department and bringing the comprehensiveness of rehabilitation, everything under one umbrella, ensuring that the complications are minimum, outcome-driven and goal-oriented care to all the patients, and focusing on patient self-independence. At ISIC, rehabilitation is not just a part of treatment. It is a symbol of hope, recovery, and renewal. Our commitment is to walk through this journey with you, step by step, hand in hand, and taking you back to your life that you love. Thank you.